Welcome to Wealth Expansion Forum, where mindset drives you, skill set builds you, tool set scales you, and asset secures your legacy.
Hey guys, welcome to another episode of Wealth Expansion Forum. I am your host, Keith Robertson, the Fin Coach. Listen, the conversation has not changed, guys. We're still talking about. So, guys, I'm going to introduce you to Jamie Bullock. Okay, so I'm bringing him forward because we've had conversations and it has been a bunch of questions. What is ConnectMD? We talked with Dr. Pitts. But now I want to get down to the grassroots. I want to introduce you to Jamie, someone that has utilized the services and is now a part of the company. Jamie, how are you today?
I'm good. I appreciate you having me on, Keith. Thank you very much, Mr. Robertson.
Now, thank you for taking time out of your schedule. I'm quite sure you're busy. Matter of fact, I know you're busy. I know,
Yeah,
I know you are because I know what's going on, right?
yeah,
So,
absolutely.
we wanted to kind of dig in, as here in Hampton Roads, people they don't know what ConnectMD is. We're launching here, and I wanted to give them a better understanding from the inside and the person that's utilizing the services. So
Okay.
let me ask you, how did you even find out about ConnectMD in the beginning for
Yeah.
yourself?
Well, it's amazing how certain people come into your life for the right reasons, and when your missions and your values are aligned, they kind of they lead you to the right places and where you should be. But my joining ConnectMD, just to be honest, was involuntarily. I was a friend and a supporter of Dr. Casual Pitts. He said, "I have this amazing thing. I've got to share it with you. I just want you to tell me what you think." And he sent me a video. It was amazing. But I currently had great insurance that I loved. I have a PPO through a very, very well-known insurance company. So I didn't exactly feel the need for it at first. So I told him what I thought about it, shared it. This is great for the people who need it. And then he let me know, well, you're officially enrolled. You're going to be an agent under me, and I need good people that are going to help me go spread this out to other good people. So I got involved without permission, but I'm so glad that I did. And those are the kind of people you want around you when they know that you have a good heart and that you want to make a difference. Those are the people that really, really see the value in ConnectMD and see how much of an impact it can make in people's lives. So that's how I got started. It was over 2 years ago now. I've already hit my 2 year anniversary. So I started out as an agent and a member. I immediately enrolled because the rest of my family did not have health insurance of any kind. And since ConnectMD is not insurance, but a healthcare membership, it filled the gap of my family not having anything at all. So it was something I could use on top of my insurance, and then it filled in the gap for my family. So I've had a membership and an agency for over 2 years now, and love the company, love the services. I really believe everybody should know about it.
Got it. So let me ask you this. When you say fill the gap, a lot of people out there may not really understand what that is. Could you speak to that, please?
Yeah, absolutely. There are, and I don't have the exact number. There's millions of people in America that don't have any type of health insurance. More importantly, they don't, some of them even have a way to get to the doctor if they do have a need. They don't have the funds to pay for a $250 urgent care visit, or they don't have the means to cover their whole family. They have to literally pick and choose between who in the family is going to have access to get to the doctor or get to a prescription because of either access, finances, transportation. And then there's a lot of us who just weren't raised to make our medical history and our medical care, our self care a priority. So when we go down the list of necessities, a lot of people don't put healthcare on that list, but it should be. It's a right that everybody should have, and it's something that everybody should be able to get access to on an affordable level. And that's what ConnectMD is, because it's not insurance, because there's no contracts, there's no denials, and it doesn't matter if you've been sick for years or have pre-existing conditions. Anybody can literally use ConnectMD. A social security number isn't even required. So it's not insurance. It doesn't have all that red tape boundaries that come with insurance where you have to qualify, open enrollment. None of that matters. It fills the gap and the space where so many people fall through the cracks and don't have anything to
Mhm.
offer or can't afford to have anything. KMD is not that. It's literally healthcare access for everybody because it's a membership.
Got it. So what would you say to the person that would say, hey, I don't need this because this is only telehealth.
Oh yeah, no, it's so much more than telehealth. And sometimes it's just a mindset thing because we don't know what we don't know. But COVID taught us a lot. None of us were going into doctors. None of us were going into hospitals unless we absolutely had to, but everybody was getting sicker on a grander scale than we ever have before. So there's no such thing as only telehealth. Our phones are unlimited in what they can do. We're talking to people across the world. We're sending videos and content. We're doing everything on our phones. So being able to talk to a doctor as clear as me and you are talking, being able to see a doctor's face, show them what it is you're concerned about, and more importantly, not feel rushed because you have saved the gas money, you've saved the time in the waiting room, you haven't exposed yourself to any other germs from other sick people. Only telehealth is such a limited mindset thing because telehealth literally widens and broadens all of the benefits. It's only going into the doctor gives you a limited amount of time. Telehealth, they don't rush you off the phone. They
Mhm.
let you ask all the questions you want to. The paperwork is already done. Everything's done digitally. So when you get to telehealth, you actually get a very high quality experience. You get highly qualified doctors. And it can be video, it can be over the phone, it can be message a specialist. There's so many aspects to ConnectMD that go beyond just making a phone call. There's no limits to what we can do in ConnectMD when it comes to just needing to speak to a physician. And more importantly, it gets done faster. You have quicker access to a doctor when you need it because that's the whole purpose behind it.
Wonderful, wonderful. Thank you for that. So, how about you telling us an experience that you've had utilizing the services?
Yeah, absolutely. So I've used a lot of them. I do believe in being a product of the product. One of the reasons I love the company so much is because of the heart of ConnectMD. Its mission is to make sure everybody has it when they need it. So despite me having an insurance plan, I have a primary care physician that I love. I've been with him for 12 years. He's less than 10 minutes down the road. And when I go in to see a doctor, it's zero cost. So there's no reason for me to not be able to get to him except Friday at 5 o'clock, he goes back to life.
Yeah, yeah.
Saturdays, sometimes he's open, sometimes he's not. And
Uh-huh, uh-huh.
Sundays, health issues pop up. So despite having the best possible scenario that you can get, even with insurance, I go to ConnectMD first. If I have any issue before I go see my primary care physician, I go into my KMD portal. So I've done it as soon as I feel anything in my throat that's scratchy. I was traveling, when you get around airport, big groups, networking events, I'm OCD, so I'm sanitizing all the time, but my throat was feeling funny and I could tell the signs. Nobody likes to get sick. So as soon as it hit, I was able to call ConnectMD. It was Friday night at 11 o'clock. My head never
Mhm.
left my pillow. My head never left my pillow. It was Friday night, 11 o'clock, called in, had a doctor call me back in less than 20 minutes. Not only did I have a consultation where he went over all of my current medications, all of my current health issues, asked me, do you prefer to take a natural route? Do you want some natural remedies? Do you have allergies? How do you prefer to handle your health care? For a doctor to even care to ask that before just shoving a pill down your throat or a quick here, all you need is a Z-Pack, spoke a lot to me. So by 11 o'clock Friday night, 20 minutes, I had a full, complete assessment, a diagnosis, and my prescription was ready the very next morning on a Saturday morning. I went straight into Publix. The best part, of course, was I spent $0 to speak with the doctor. I spent $0 to get my prescription, and I would have had to wait Friday night all day Saturday, Saturday night, all day Sunday, and then hope that my doctor could see me as a walk in on Monday. And by that time, I could have been full fledged sick or gave it to somebody in my household. None of that happened because I had access to ConnectMD. And that's just one of the things that I've done. I've also used the pet services. I know that
Wow.
healthcare is big
So
on
that is a big piece now. Big piece,
yeah,
four-legged babies. Yeah. Uh-huh.
yeah, yeah. And I have four of them. I'm a fur baby lover. I love my dogs. I really do. And I don't know what's wrong with me, but three just, I guess, was not enough. So I decided in December I was going to get me another puppy. Um, my children I call them the business partners I birthed. They're grown now, so I don't know if I just felt like it was time to get another baby, whatever the case may be.
Uh-huh.
got a puppy that has a unique personality, was doing his zoomies around the house. And like I said, I've had dogs for forever, but I had an experience I'd never experienced before. When the dogs do the zoomies and they run and slide into something, bump their head, or whatever it was that he may have did, all of a sudden one of his pupils was so dilated it looked like a horror movie. It was
Oh,
really,
wow.
really one of his eyes was like the size of a very small piece of fuzz, his pupil. The other eye was normal. It was scary. It was again an 11 o'clock at night situation. Vets are closed. The
Uh-huh.
emergency vets around here, that's 375 to 500 just to get seen, period. And they're not close by. The ones that stay open 24 hours are expensive and they're far away. Even being in Atlanta, the selection is limited. Because I had the titanium, which includes the plan, or if anybody that just has the pet plan, I was able to get a veterinarian on the phone within 10 minutes. I sent a picture of took a picture of the dog in between my panic attack and and had a vet on the phone that it was so reassuring. Not only did she assure me what could have caused it, what I should look out for if it doesn't correct itself,
Mhm.
stayed on the phone with me until she made sure that it was starting to correct itself, gave me education on different things about my dog's personality, made a really, really great connection with that vet, and I didn't have to get a prescription. I didn't have to take them anywhere, leave with my dog to go anywhere. The stress level was just as big of a benefit to me as the saving the money, because when
Mm.
we love our pets and we don't know what to
Yeah.
do, it was amazing the education that I had and how much money I saved. And again, I spoke with a very experienced veterinarian who spent almost an hour on the phone with me, just having conversations. We connected, speaking about things. She was amazing. Her name was Laura, and it
Mhm.
cost $0. It cost me
Wow.
$0. Yeah.
Thank God for ConnectMD.
Amen. Amen.
Wow. You know, because I can definitely understand the situation there. Because I remember when we had a Rockwile and I used to have to take him to the vet. And it was just traumatizing to him for one, going in there, seeing the other animals and reacting to the other animals and then reacting to the veterinarians as well. But being able to take care of this from the comfort of your own home, it really speaks to the power of ConnectMD. And you did mention something else too. You mentioned that you were traveling. And so I was telling the people that, this is you can utilize this anywhere you are in the US.
Absolutely. So I travel a lot, sometimes with Dr. Pitts for different reasons or just for family, things like that. But ConnectMD goes where you do. Basically, ConnectMD is on your phone. So we don't go anywhere without that, anywhere. ConnectMD comes with you if you travel to any of the states or U.S. territories. So you've got Puerto Rico, you've got the Virgin Islands, you've got any of the U.S. territories. You can use ConnectMD there, and it's not just any state; it's anywhere. It doesn't matter that it's 11 o'clock at night here or 1 o'clock in the morning there. ConnectMD is in every state, every territory. It's 24/7 and it's 365 days a year. So if New Year's is popping off and you're in the city of New York, you don't have to go to the hospitals or any of those crowded areas. You can use it anywhere.
The prescriptions, right?
Mhm.
The RX capabilities of ConnectMD. I know you said you got a prescription, it was zero cost, but can you speak to that as far as utilizing that system and what you've experienced as far as the medication?
Yeah, absolutely. And understanding is really important with ConnectMD because the benefits are amazing, but you do have to know how it works to really see the benefit in it. So you have your acute medications or in your chronic. So if you think of acute, it's something you have a problem that just came up, you need the medication to take care of it and it'll resolve the problem. So you've got a skin rash, you need a cream, you need a Z-Pack, an antibiotic, a whatever steroid, something really quick that you're only going to take for a certain amount of time and you're done with it. So there are 37 the top acute medications that somebody would need in an acute situation that are absolutely free. So you can print out your RX card that's in the back of your ConnectMD, screenshot it, however you want to do it. But you'll have an RX card that you take into the pharmacy to get any of those 37 acute medications absolutely free. Everything on the acute formulary is generic, so just something good to know. And then you have 1,000 chronic medications that are free, that are on the formulary. They're all also the generic form. So out of those 1,000 medications, you will get a 90-day ship supply for zero cost.
Oh,
So
wow.
once you get your prescription, you upload it into ConnectMD. It'll come to your house free for the medication, no gas money. Open your door, get your meds. Now, if you do have a chronic medication that you need filled right now before you can get your 90-day supply, you can walk in with your ConnectMD card and get a discount on that one. Some of them are cheaper at different pharmacies, so you can check in your back office. It'll literally let you know when you put in your zip code what medication it will be if you have to get it in person, what the discount will be, or if you can get your doctor to just send in a 90-day supply, then it can be shipped to you for free. But you can get your medications refilled immediately through urgent care, and you can use the services through the primary care physician to continue getting your medications filled. But whether you need a refill or you're already on medication or you need to be prescribed medication, all of that is handled through ConnectMD's prescription program.
Here's a question that just came up. Thank
Okay.
you. So, how about someone that has kids
Okay.
utilizing it? Is there a age limit to those that can utilize ConnectMD?
Yeah, and that's the other thing that when I said at the beginning that ConnectMD is for everybody, it was designed to make sure you and your entire family of loved ones are covered. So you have a plan that has the first person, whoever the second person is, the spouse or the next oldest person would go onto the plan. Then you're allowed to add 6 additional people that are 25 years or younger. Now, the second person, obviously, if it's your spouse or your significant other, whichever one that is, the two oldest would go. You, whoever you're adding to your plan, is your significant other or your number two. Then the following 6 people would need to be 25 and under, but you can literally add 6 people to the plan for free. It does not cost you anything extra. And
Mhm.
all of them will have their own HIPAA compliant portal unless they're under 18. Then of course the parents would have access to that. But
Uh-huh.
despite covering the whole family, those families' individual private records are still HIPAA compliant. Everybody has their own portal. And then anybody who's 26 or over can get a plan, any of the plans that are 60, 80, or $100 to cover themselves. And then the same rules apply. They can also add them, their family and their loved ones as they need to it.
What determines if a person can be added to your plan? Do they need to be in your household? How does that work? They need to be a dependent? What is the
Yeah, so
criteria there?
we're following all guidelines, and because ConnectMD is so affordable, everybody can afford to have their own plan. But the people that are listed under you should be somebody that you legally are responsible for or in your household. So if you have other relatives living with you, but you take care of them in their household, they're under 25. They definitely can be on the plan. If you have a cousin that lives in another state that just doesn't want to buy his own membership, he should have his own membership. You want to make sure that it's people in your household and that you're responsible for, because that's what it was designed to be. That's the proper compliant way to have it. But it also matters because of the shipping address. And when you get those medications, whatever address is there is where those will be shipped to. Now, there is an exception. There are a few exceptions if you have parents that you're caring for
Yes, yes,
and you have the legal documentation that can be provided. Obviously, if you're a caretaker for somebody like that, ConnectMD understands. They have ways of making sure that the entire family in the household is taken care of. You also have some kids who are part of your household, but they're off at Harvard or they're down at Spelman, and so your college children can be on your plan if they're under 25 and if they're still a part of your home, but they're off at school. Or we've have had a lot of people who once they go to college, they just decide they want to have their own plan. Parents teaching their kids, this is your bill, this is your responsibility. So that doesn't mean that they have to be. But if you have kids away at college that are under the age of 25, but not living with you for that semester, that doesn't disqualify them. They're still in your household and they can still use the services.
Okay, okay. Thank you.
Yeah.
So let's dig in here as May is mental health month.
Amen.
And a big part of ConnectMD has to do with mental health.
One of the most valuable ones to me because it fills such a need. Um, Mental Health Month, it means a lot to me personally because of just different circumstances. But there are so many people that are struggling. The numbers go up every single day. The last time that I checked in 2024, 61.5 million Americans dealt with some type of mental health issue last year. So when you do the math, that's 1 in 4. And those are just the people that are admitting it. Those are just the
Yeah.
ones who are admitting it and that it's been documented. So we know that number's higher. We know that men go through it. They hold in a lot of different things. They don't feel like they have somewhere to go to. They carry the weight of the family and work and have been taught boys don't cry and all that stuff. They hold
Yeah.
in a lot. Then you've got your mothers who are single or married. Either way, they're carrying the weight of the family, they're carrying the weight of the world and of their home and of the finances, and the children. Our kids are going through mental health earlier and earlier and earlier in these
Yes.
schools.
Yes.
And we're losing a lot of people that are losing the battle with mental health. So it's a very, very touchy, not touchy, but passionate,
Yes. Mhm.
for me. The need is so great for not just the awareness, but the treatment, for the resources, for people to feel like there's not a stigma behind it, for people to feel that they can get help or access help without being shamed by their employer, or without thinking they're, as an entrepreneur, going to lose a contract because the subject may come up, which is what makes ConnectMD so valuable. You have people that know they need assistance, but are either not in a mental space or have the bandwidth to go somewhere, to sit, to talk to somebody, to take the time off of work. ConnectMD provides one of the most valuable resources to me is a 24/7 crisis line. You can call for free at any time. Man, woman, child, as long as you're 12 years or older. Under 12, we definitely want to make sure that they're seen by a specialist, that specializes in that, because there's more sensitive things in dealing with a child's health. But as long as they are 12 years or older, anybody out of the 8 people on your plan can call 24/7 for free and get a qualified counselor on the phone. They can go through crisis management. They can make sure that no matter what it is you're going through, and it's not just mental health. When you call them, it is literally anything that goes into life. So if you take away the mental health of it and just kind of put a broader range of counseling on it, if you're looking for an apartment and it's getting heavy and I can't figure out where to go next, and I've Googled everything I can Google, they will literally walk through and help you figure out resources. If you have a legal issue and you don't know where to turn, ConnectMD's counseling services have people in that department that will help talk to you and point you in the right direction and give you qualified advice on what to do about that life circumstance. If you're going through student life, there's counselors that will handle that. If you're going through marriage counseling, or marriage issues, if you're dealing with grief, there's counselors that specialize in that are available 24/7. If you are going through financial, you said that you were in the financial, business and financial literacy, and they literally have debt management and life coaching and how to start your business. When I tell you that it's not just mental health, the counseling factor of it is so broad. You can literally call them for anything. They will ask you questions. They will take time with you with tenderness and patience, and they will give you every resource and every amount of coping skills, everything that makes you feel that you're heard, that you're being assisted, and it's free. It's zero cost for that counselor line.
So what if you need some type of plan? It's you're not in crisis, but you need assistance. How does it help you there?
Absolutely. So when you call the mental, the counseling line, there's different phases to it. So we have the 24/7 line. You can get up to 6 visits per quarter per person on the plan. So they will give you 6 sessions to make sure you have some coping skills. You do some more check-ins. What progress have we made? What new things have we figured out? You will get 6 sessions for zero cost to work on that specific item, that specific struggle, that
Mhm.
specific topic. And that's every quarter for every person in there. If you need medication, if it has become something where there's a psychiatric medication is needed to cope, those are at a discounted rate and available. You get those, they will send you a referral over, and you can use the counseling services in person or telehealth. This is one of the exceptions where ConnectMD, when it comes to your mental health, if you need that human connection, that in person it's available. And so there's psychiatric, where medicines would be prescribed and available at a discounted rate. And then there is psychology. If you need to go beyond those 6 sessions and this needs to be a longer term care and you just want to do that, it's discounted to do that as well. So there's your 24/7 counseling crisis line. Then there's the free sessions that you can get, which is 6 to quarter. If you need to go beyond that, they can refer you out. There is a fee. I want to say 125, but don't quote me on it. I could be wrong. For your initial session, and then there's a smaller fee for every additional session after that. If you need to do psychology or psychiatric on a larger scale, a more long-term scale, it still saves you a lot of money, and you can do that through telehealth or in person if you prefer. And if you go to the psychiatric or the psychology and pay for those sessions, that does not disqualify you from calling back and getting the counseling or the 24/7 line at any time. It's not an either or. They're there to take care of the whole person and be there for whatever needs you have.
Oh, wow, that's great. That is fantastic.
Yeah.
There's definitely a need in the community.
Yeah.
It is. I just saw a article just this past weekend on how teen suicide rate is up. You know,
Yeah.
young African American
Absolutely.
males, the
Yeah.
rate is up as far as suicide.
Yeah.
I mean, it's across the board, so it's definitely real
It
in
is.
a need for it. So I am so glad that I am able to introduce this to Hampton Roads. I really am. So as far as children under 12, so what would that be? Would that be a referral to someone else to see or? Mhm.
They do. And ConnectMD has something else that they call patient advocacy that's available to every single member. If there is a service that ConnectMD does not provide, does not cover, there is a service that's called patient advocacy where they will help you understand the needs that you have, help you find a place that will work in your area, in your budget. They will help try to work out pricing for you, and none of it is guaranteed like any advocacy, obviously. But you're not left alone. If ConnectMD cannot fill your need in this portal, in what we provide, in any kind of way, you literally have an advocate that will hold your hand and walk you through what benefits you need, what benefits you may have access to, what community resources may be available in your area. They will help walk you through and find what you need for that. And then, of course, the crisis line, if you called with somebody under 12, they, of course, would give attention to make sure that they directed you to the proper place. So don't hesitate if it's you or a family member going through things. If the parent has to call and this is what we're dealing with, and I need some assistance, we want to be there for everybody. And the mental health is so needed. It's passionate to me. I lost my father to suicide. This past weekend, we lost another family member to suicide, and this is 20 something years apart from these instances. But my son struggles with really bad anxiety. It's just there's so many people that mental health runs in the family, and it's not all mental health. It can literally just be lifing.
Yeah.
You can call this line and say, I think I'm okay, but things are feeling a little bit heavy right now. I got a new eye twitch that has developed with
Yeah.
with these bills, and I just need to make sure that I am okay. It can be as simple as a check-in to say things, this is what's been going on. I want to feel like I have somebody to talk to, that I don't have to worry about them telling my business, that I
Mhm.
don't have to feel like I'm paying out of pocket just to check and make sure that my gauges are all still firing at the right levels, or just to get it off my chest so that I can keep functioning the way I need to. It doesn't have to be a mental health issue. Everybody goes through stress and problems and life happening. It's just something that's going to continue to happen. So knowing that you have that resource there for when you need it and for whatever that need may be is just huge. And I think if people knew that that was there, we would catch a lot more of these before they got so bad, instead of hearing that we've lost somebody, or instead of hearing that somebody fell alone. It's so needed, and the more people that talk about it, the more people that understand it and offer it, the more lives we can impact, because it really does connect to the full health. Our physical health and our mental health are connected. When your mental health is not properly calibrated, it starts to affect your physical health. That's where the heart attacks and the strokes come in and the anxiety. They're connected. So to take care of the whole person, it matters that you're taking care of not only your physical health, but your mental health. And when you can merge those two together, ConnectMD is one of the amazing places that fills that in for you.
Well, Jamie, I tell you, I really appreciate what you've done today. You know, you've really showed us the value.
Oh,
You know,
absolutely.
someone asked me, why is it so cheap? I'm like, it's not cheap. It's at a affordable rate because the company is here to actually be of service and want to be of
Absolutely.
service to more people, to give you the
Right.
availability to do all of this from the comfort of your own home. You know, we talk about the mental health piece, like you said, it could be a stigma, right? No one wants, I'm embarrassed. I don't want to go out and people are going to see me going to this building. Where you're able to do this from the comfort of your home, especially the brothers, right? You
Right,
know,
right.
yeah.
Mental health matters. It really does. And and
Mhm.
and, and we need our kings. We need our fathers. We
Absolutely.
need our sons. We need our brothers and our uncles. And we
Right.
need them to know that their feelings matter. They're allowed to have feelings. We need them to know that being tough and rough isn't in your best interest or anybody else's. You can be a better head. You can be a better lead. You can be stronger when you're taking care of yourself. The same way you build up those muscles in the gym is the same way you can build up your mind and your heart so that you can continue to be the rock for everybody else. But there is absolutely nothing wrong with a man taking care of himself. And we need our men to know that. And if it helps to do it in privacy, if it helps to speak to somebody that you know is not going to judge you for you being human, if it
Mhm.
helps to know that it's there at whatever time you are ready and able to discuss it instead of being pushed into it, it makes a difference. And it's really, really important that our boys, our men, our brothers, our uncles, our bosses know that they're allowed to be human, that their feelings matter, that their mental health matters, and that being tough and pushing through it is not what's best for you or for your loved ones. You have to take care of your mind and heart, and ConnectMD helps do that. It's an amazing resource for a lot of men that have called and gotten the help that they need or just the checkup. It can be just a I need to laugh, I need to talk about this certain circumstance, and did I handle it right, or do you have any suggestions on how I can talk better to my wife, because I feel like I'm telling the heater to turn on the AC when I talk to her. Like she's emotional, I'm logical, and we're just
Yeah,
not
yeah,
connecting. So
yeah.
even if it's just learning, I might need some help in how I'm communicating. It can be that simple. But if it increases the quality of your relationship, the quality of your life, the quality of your coping skills, it's valuable and it's there for zero cost. It's definitely not a cheap service. It's affordable, and it's affordable so the help can be there. He wanted everybody to have it within their reach. The founder of the company, Jason, I've seen his heart in person. I've seen what he does on spur of the moments to be there for somebody that he knows needed it. He created the company because he literally went to a house to deliver some medical supplies. He had a medical supply company. The and this is true story. This isn't any type of tagline or anything like that. The woman was getting the medical device that she needed, and the baby had that croupy cough. Not just that, they need to cover their mouth and they got allergies. We all have heard those coughs come from people where it's like, oh God, they're not okay, or they need attention, especially coming from a kid. And he said, you really got to get them to the doctor. And the mother looked at him with some pain in her eyes and said, I can take him to the doctor or I can feed him, but I can't do both.
Oh, wow. Mhm.
Reality. That's
Yeah.
reality for so many people. So there's a story behind the affordability. There is a reason why Jason has refused to move just the healthcare service membership above $100. He has said he will always keep it that way because a family of 8 can come up, you can cut some grass, you can come up with $100 or 60, which is the smallest membership, to make sure your family can get their medication and get seen by a doctor. It's not free, but it is affordable, and it's that
Mhm.
way for a reason, because nobody should have to choose between feeding their kid or getting their kid medicine.
Absolutely.
Nobody should have to break their pills in half and take a less medication because they can't afford to buy anymore for the next 3 months. And we start stretching our medication, or we put off going to the doctor and try to do some over the counter remedies when we know it might be something more serious. And now it's turned into a life and death issue, or now we've lost somebody because they didn't take their health seriously. ConnectMD is there for that reason, which is why it's affordable quality healthcare access and not just a cheap substitute.
Well said. Well said, Jamie. And again, I really thank you for taking time out of your schedule. I mean,
My
you've
pleasure.
given me what I wanted and more.
Good,
I wanted
good.
the people to really understand what ConnectMD is and what's coming here to Hampton Roads. And I'm just elated, actually. You know, I feel privileged to be able to bring this here to the area.
Right.
Absolutely.
Keep it good. You're going to help a lot of families. You really are. I hope that people get the information they need. And there's so much more. This is the tip of the iceberg with ConnectMD. There is so much more. My daughter has extreme eczema. Her skin will crack and bleed when the seasons change. There's free dermatology. You get to message a specialist. There's so much more. This is just the tip of the iceberg of all the things that ConnectMD can do. So reach out to Keith, ask the questions. If he doesn't have the answer, he can get to somebody who does. If I don't have the answer, I can get to somebody who does.
Yeah.
I know what I know, but I know somebody who knows what I don't, and I can get to him. So ask him the questions. And more importantly, timing is everything. Because there's no contracts and no committals, make sure you know who Keith is and what he can help you with. And when the timing comes, if right now is not the time and you don't need it right now, the great thing about ConnectMD is the same day you get the services is the same day that you can use them. Everybody is going to need ConnectMD services at some point. So make sure you know that he has it available. Make sure you reach out to him, save him in your phone, whether it's for today or whether it's for when you need it. That is exactly the purpose of ConnectMD.
Well, thank you for that, Jamie. Did y'all hear that? Reach out to Keith. Reach out to me. Yeah, give me a call for sure. But Jamie, hey, is it anything else you want to add or anything you would like to say before we end this?
Really, really grateful to be in the same company. We work in business for ourselves, but never by ourselves. The
Yeah,
ConnectMD family is real. We're all here to help and support each other. And it takes a special kind of someone that wants to do something that serves other people and that's going to make an impact. We all have to make a living, but those who choose to make a living by helping others says a lot about them. So just kudos to you, Keith, to your character and to your desire to do well in your area. I really do believe that you will, and don't ever get discouraged. You keep spreading it. It's
absolutely.
going to make a real difference in real lives, and I think that I'm really proud and blessed to see you wanting to do that, and I hope you are very successful in doing it.
Well, thank you so much, Jamie. I really appreciate your time again, and I look forward to talking with you. I'll be talking with you here soon, anyway. You know,
Yeah,
either text or calling. Yeah, yeah, because you've been an assistance to me already. So yeah. But thank you again, and I definitely look forward to even having you come back on another date. You know, and sharing more information. Yeah.
absolutely, for sure. Well, you and the beautiful people of your neighborhood and town have a beautiful day, and thank you for having me on.
Thanks a lot. Now you take care and enjoy the rest of your day. Well, guys, I
You
hope you
too.
got a
Bye
lot
bye.
out of that episode. Jamie, I want to thank you one more time just for taking time out of your busy schedule. Guys, when I tell you Jamie Bullock is busy, her phone rings 24/7. I'm a witness to that because I've called her myself on multiple occasions, right? But anyway, listen, guys, ConnectMD is the answer to a lot of people's prayers. When you have to make a decision between medication and food, when you have multiple family members and you can't put them on your plan, when you cannot afford traditional health insurance or the convenience, right? And the mental health piece is phenomenal, as you just heard. Launching here in Hampton Roads, May 21st. We're doing a live event. You can go to Eventbrite, look up the Wealth Expansion Forum, and see that event. Or I'm going to have it either here, or here. I'm going to have it somewhere around this video in which you're able to go ahead and click on it and register. But listen, seats are limited, so don't hesitate. But guys, I want to thank you again for tuning in to another episode of the Wealth Expansion Forum. I'm your host, Keith Robertson. Hope to see you next time. Peace and blessings.
Free support when the pressure too long. We don't play with the stress, we address that. KonnectMD, put your life on the best track. Yeah. KonnectMD, yeah, we tapped in. Healthcare membership, we locked in. Not insurance, don't get it twisted. 24/7 doc when you need assistance. Travel discounts, yeah, we gon' slide. Lifestyle club, keep your peace aside. Free mental health, that's real love. We level up, whole life, not just one plug. Tell them it's a club, not a policy. Real ones, no value, that's quality. For the self-made, for the 9 to 5. For the ones tryna heal and still survive. If you got goals, you need your health right. If you got dreams, you need your head right. We talk wellness, we talk progress. More life, less stress, that's the message. So tap in now, don't wait on later. KonnectMD, whole life ever later. Lifestyle wins, that's the plan. Membership way, bring your fam. KonnectMD, not insurance, access to slavery. Let's go. KonnectMD. Lifestyle club.